Mayo Clinic registered nurse Kandi Holt is here today to talk to us about centering pregnancy. And it's not necessarily a new concept, but it's a fairly new concept here. So give us an idea how this is different, because it's about group care.
Correct, and we've been doing our program for almost 2.5 years, and it's been very successful. Patients do choose a midwife or a doctor that is their provider, and centering pregnancy takes place and starts between 12 to 18 weeks along in the pregnancy and ends between 32 and 38 weeks in the pregnancy. And then a patient goes back to their provider for the remainder of their care.
Okay, and the thing is, the concept is you bring a number of women together to do their appointments together. How many are in a group?
The groups consist of 5 to 8 women within a similar gestational age. There is a 6-week span of due dates.
Okay, so the theory behind this is then that women will get all kinds of information from each other too.
Correct, yes. Besides the information that we present and discuss between the midwife and the registered nurse, patients definitely learn from each other, as well as we as providers will learn from the patients as well.
Okay, so who are the health providers who are there?
Yes, it consists of a certified nurse midwife and a registered nurse, and it is that same group, that same pair throughout that whole centering pregnancy experience. And so we really develop a relationship with those patients.
All right, and even though these are considered group appointments, every woman is checked each time and baby is checked each time to see how they're doing, and there is privacy for that, correct?
Correct.
So how does that work?
Yep, what happens is the beginning of the session, and this I want to make note is an hour-and-a-half long session compared to a 15 or 20-minute appointment that patients would traditionally have. So it's an extended amount of contact with us. And the first half an hour, patients are circulating between seeing the midwife in a private area that's screened off in the room that we're in, and patients are seeing the midwife. They're circulating between getting their blood pressure taken, weighing themselves, having refreshments, and socializing.
So there's a lot of things going on. And one last thing, you said it also, because you're having the women also keep track of a lot of their health care as well, it keeps them more involved and aware of their own health care and how it's going.
Correct.
What are some of those things they're doing?
Yep, each patient is given a book where they record their own weight, they record their blood pressure, baby's movement, baby's heart rate, and the size of their uterus consecutively through each visit. And so we have that information recorded as well, but they're able to track and be aware of how their body is changing and have that to look back on.
Very good. And Kandi, thanks so much for joining us today,
Thank
too.
You.